Gentlemen, think back to the last time you found yourself standing in front of the toilet at 3:01 a.m., eyes half open, exhausted, and irritated. Did you feel that sharp flicker of fear? The urine flow was weak again, barely there, and for a moment you wondered if this was just how life was going to be from now on. Maybe you glanced at yourself in the bathroom mirror, looking worn down and uneasy, thinking, "This isn't how it used to be." You remember when you could sleep straight through the night and empty your bladder easily, confidently, without effort, but now things feel different. The stream has turned into a slow dribble, and you're heading to the bathroom more often than your own 80-year-old father ever did. It can feel like your body has turned against you, like something essential is slipping away. Here's what's most likely going on. The gland that surrounds your urine channel, known as the prostate, has been gradually enlarging. The medical name for this is benign prostatic hyperplasia, or BPH. After the age of 50, this process often speeds up. But before panic sets in, I want to calm your mind. What you're experiencing is not permanent damage. It's not a one-way decline. What's happening is a restriction, and restrictions can be reversed. That narrowing sensation, the weaker stream you're noticing, is not your destiny. It's simply your prostate squeezing too tightly around the urethra, and that swollen, tense state can be eased. Today, I'm going to walk you through how to reduce that prostate swelling and bring back comfort using a simple pantry item that costs about $2. It's probably sitting right next to your baking flour right now. Yes, really. Just a couple of dollars at any grocery store, and it can begin easing the internal pressure that's robbing you of sleep and confidence. I know how unbelievable that sounds. Most of the men I see in my practice come in convinced their prostate will only keep growing. Their urine flow will keep weakening, and their nights will become longer and more miserable. But that belief doesn't reflect how the human body actually works. In many situations, the prostate responds directly to the internal environment you create. Change that environment, and the pressure starts to release. I'm Dr. Exa, and I've spent over 20 years as a practicing urologist focused on men's health. I've watched men walk into my office drained from nightly bathroom trips, convinced nothing could help them, and then return weeks later sleeping through the night again. In many of those cases, the turning point began with one very simple daily adjustment. Now, you might be thinking, I've heard big promises before. Why should this be any different? That's a fair question. So instead of asking you to just take my word for it, I want you to run a small test tonight. A simple experiment to show you that your body still knows how to improve. Tonight, about 1 hour before bed, take a glass and pour in around 8 ounces of water. Add 1/4 teaspoon of baking soda. Make sure the label says aluminum-free. Stir it thoroughly until fully dissolved, then drink it. That's all. Tomorrow morning, pay close attention to your first trip to the bathroom. Notice your urine stream carefully. Does it have more power? Is it wider? Does it begin more easily, with less waiting and straining? Listen to how it sounds hitting the water. If you notice an improvement, what you're seeing is real-time feedback from your body. The lining of your urinary tract is made up of smooth muscle tissue. That baking soda drink gently adjusts your internal chemistry just enough to help those muscles relax slightly, allowing the passageway to open more. That's proof. Proof that your tissues and muscles are still responsive when given the right conditions. Some men also notice that their urine looks clearer the next morning, which is another positive sign. It suggests your kidneys are filtering more efficiently with that subtle chemical shift. Now, understand this clearly. That single drink is like tapping on a rusty pipe. Water flows more easily right away, showing the pipe isn't completely blocked. But the deeper buildup that formed over years is still there. One dose does not cure prostate swelling. It cannot undo long-term inflammation overnight. It's a demonstration, not a solution. What it does show you is what's possible. Real, lasting change comes from a consistent protocol that addresses why your prostate became swollen and restrictive in the first place. So try that experiment tonight. Use aluminum-free baking soda. Observe what happens tomorrow. That experience is your entry point. Now let's break down why that baking soda trick works and what's actually happening inside your body. Picture your bladder as a water balloon. Its job is to store urine. At the bottom of that balloon is a small opening, and wrapped tightly around that opening sits your prostate gland. The urethra, the tube that carries urine out of your body, runs straight through the center of the prostate. In a younger man, the prostate is about the size of a walnut, and the channel through it is open and flexible. As men move into their 50s and beyond, two important changes often occur. First, the prostate increases in size. Second, and this is critical, the tissue inside the prostate becomes swollen and stiff. Now you have a larger, firmer gland squeezing the only exit your bladder has. When your bladder tries to empty, it pushes against this tightened ring. Even if the bladder pressure is strong, the output is weak because the pathway is narrowed. That's why you feel straining, hesitation, and reduced force. Many doctors focus only on the physical narrowing, the size of the gland pressing on the urethra. What often gets overlooked is the biochemical environment that makes that clamp so tight. Let's get to the root cause. What actually causes the prostate to swell? In my clinical experience, one of the biggest contributors is internal chemistry, specifically a shift toward acidity. Your blood and tissues are designed to stay in a delicate balance. When that balance tilts slightly toward acidity, it creates a hidden problem. This acidic state encourages chronic, low-grade inflammation throughout your body. Your prostate is especially sensitive to this. Inflamed tissue holds onto fluid. It becomes congested, puffy, and rigid. An acidic internal environment directly feeds prostate swelling, turning a normally soft gland into a firm, restrictive one. You're not just dealing with growth, you're dealing with pressure from within. Research shows that the average blood pH of a man in his 50s is often 1 or 2/10 of a point more acidic than that of a man in his 30s. On paper, this still falls within the normal range, so it's usually ignored. But for the prostate, that small difference is massive. It's the difference between calm water and water that's constantly rippling. Combine this acidity with the natural enlargement that comes with age, and the picture becomes clear. The space is already reduced. Add inflamed tissue and the functional opening can shrink by half or more. This also explains something men tell me all the time. Their symptoms vary wildly. One day feels manageable, the next feels unbearable. Sound familiar? Your pH and inflammation levels shift daily. What did you eat yesterday? A heavy steak, processed foods, or excess sugar can push your system toward acidity. How stressed were you? Stress hormones increase acidity, even poor sleep plays a role. On days when you eat better, manage stress, and sleep well, inflammation drops slightly, prostate tissue relaxes, and flow improves. On acidic days, swelling increases, the clamp tightens, and symptoms flare. This roller coaster creates maddening inconsistency. Worse, it starts to mess with your mind. You begin wondering if anxiety is the cause. But worry increases stress, stress increases acidity, and the cycle continues. Once you stabilize your internal environment and guide your body away from chronic acidity, those daily swings begin to smooth out. The prostate finally gets the calm conditions it needs to relax. At this point, you may be asking, if this is about environment and alkalinity, why didn't the supplements or medications I tried fix it? Maybe you've taken saw palmetto, beta-sitosterol, or prescription drugs. Perhaps you saw some improvement, then everything stalled. These tools are designed for specific functions. Some relax certain muscles, others adjust hormones. They can help, but if your body remains acidic and inflamed, they're working uphill. One patient explained it perfectly. "Doc, it's like trying to deflate a balloon while still blowing air into it." That's exactly right. If you keep feeding the problem while trying to fix it, you cancel out your efforts. There's also another category of solutions I want to warn you about. Quick fix gimmicks that prey on frustration, prostate massagers, miracle teas, topical creams. These surface-level tricks can't resolve a deep internal issue. I don't want you wasting money, energy, or hope on things that won't deliver. What I'm sharing with you is part of a bigger, sustainable approach that creates real change. That's why I encourage you to subscribe and turn on notifications. I'll be sharing follow-up videos that complete this process. I've seen men make progress but stall because they missed one key adjustment. I don't want that happening to you. Now let's get to the core protocol. The bicarbonate prostate protocol, a 4-step plan I've used with patients to reduce prostate swelling and improve urinary function. These steps work together in sequence. Each prepares your body for the next. Skipping steps or changing the order will limit your results. Step 1 is your foundation, called the morning alkalizer. For the first 7 days, start every morning the same way. Before coffee and before food, take 8 ounces of water, add 1/4 teaspoon of aluminum-free baking soda, squeeze in the juice of half a fresh lemon, stir well, and drink. The baking soda provides an alkaline buffer. The lemon, although acidic by taste, becomes alkalizing after digestion. Together, they begin shifting your internal environment first thing in the day. Within the first 48 hours, many men notice improvement. Morning urine flow strengthens. The feeling of incomplete emptying begins to fade. Some even report fewer nighttime trips by day 2 or 3. Step 2 starts on day 5. This is a nitric oxide boost. About 30 minutes after your morning drink, take 500 ml of L-citrulline available at health stores. Timing matters. The alkalized environment makes nitric oxide production more effective and longer lasting. This step improves circulation. Tiny blood vessels around the prostate and bladder neck relax and open, bringing oxygen in and flushing inflammatory waste out. Many men notice morning erections returning, a strong sign of improved pelvic blood flow. Urination also becomes easier and more responsive. Step 3 begins around day 10. This is the tissue soak done 3 times per week. Fill a bathtub or sitz basin with warm, comfortable water. Add 2 tablespoons of baking soda. Sit and soak your pelvic area for about 15 minutes. This warm alkaline soak encourages acidic waste to leave surface tissues and reduces local inflammation. After a few sessions, men often describe a feeling of lightness or reduced congestion. Starting urination requires less effort. Step 4 begins on day 21. This is your consistency phase. Continue the morning alkalizer, but cycle it. Do it 5 days in a row, then take the weekend off. This prevents kidney dependence and encourages your body to maintain balance naturally. Think of it like training a muscle. You stress it, rest it, and it grows stronger. By weeks 3 and 4, improvements stabilize. Urgency decreases. Stream strength holds steady. Nighttime sleep improves. You're not creating something new. You're restoring function that was blocked by inflammation. If you want to accelerate results, there are 2 optional boosters. The first involves managing dietary acid load by adjusting timing. Animal proteins like red meat, chicken, and eggs are acid-forming. Large portions early in the day can undo your morning progress. The fix is simple: save larger protein portions for dinner. Keep breakfast and lunch more alkaline-focused. Smoothies with berries and almond butter, big salads with lentils or chickpeas. Then enjoy steak or fish at dinner. This keeps inflammation lower during the day and supports overnight repair when your body heals best. The second booster is beetroot powder. Beets are rich in nitrates that convert to nitric oxide. Around 3 or 4 p.m., mix 1 tablespoon into water or a smoothie. In an alkalized state, your body converts these nitrates more efficiently. This supports circulation through the evening and helps maintain urinary comfort. Men often report steadier afternoon energy and more consistent comfort into bedtime. From my clinical records, the numbers are clear. Within 30 days, about 85% of men cut nighttime bathroom trips in half. By 2 months, nearly 90% regain a normal urinary pattern for their age. Stronger flow, rare urgency, and a full emptying sensation. But the real story comes from the men themselves. One man in his early 60s said, "I got my freedom back." Another in his 70s was told by his urologist that his prostate felt less enlarged. Most common of all is peace of mind. Not worrying anymore. Feeling like yourself again. Before we finish, let's talk safety. Always use aluminum-free baking soda for drinking. If you have high blood pressure, heart conditions, or kidney disease, talk with your doctor first due to sodium content. Separate the drink from medications by at least 2 hours. For soaks, avoid broken skin and rinse afterward. Stop if irritation occurs. Listen to your body. This protocol supports prostate health. It does not replace medical care. Keep up with regular checkups. Results depend on following all 4 steps in order. Men who commit fully see the biggest changes. Your first step isn't in the kitchen, it's right here. Go to the comments and write "Day 1 tomorrow." That commitment matters. If you have questions, leave them below. Share this with a man who might need it. You might change his nights and his life. Subscribe so you don't miss the rest of this series. More guidance is coming, and each part builds on the last. This is Dr. Rabania.